talk about when we say it's normal. What do we mean by that? So thyroid tissue has a homogeneous echogenicity. So you can appreciate, so it's almost the same, homogeneous in terms of appearance. So that's the thyroid. And anterior to that is the sternocleidomastoid muscle. Then we want to say, what if nearby structure is the muscle, what is the echogenicity of thyroid gland? So it is higher than the adjacent muscle, so that we can understand when we say it's normal, what do we mean by that? It has a fine echo texture, and if you perform ultrasound of the neck and you have Doppler facilities with the machine, so they have a normal vascularity. I'll show it to you in another slide what a normal. And there shouldn't be any calcification. That's what is expected of a normal thyroid gland. I'll confine myself to this talk about the thyroid gland only, none of the structures around it, the neck. So this slide further describe about that. This is longitudinal, so the muscle is anterior, so the echo is fine, homogeneous, lower than the muscle adjacent to that. This is axial. This is what we call the normal vascularity of the thyroid glands. Sometimes you have a better machine, probably they are in the hospitals, so you can see both lobes at the same time. And this is what we call the expanded view or the view. It's useful to do Doppler as well for any organ. So in assessment of the thyroid gland, we need to localize where the inferior thyroid artery is. The inferior thyroid artery is a branch of the supraclavian artery, where the thyroid cervical trunk comes out. So the inferior thyroid artery comes out from that trunk and supply the thyroid gland. You do an axial and then you turn slightly, so it has an oblique transverse plane. So probably during the demonstration later on, given talk later, probably she can demonstrate to you to locate the inferior thyroid artery. Because it is being used in assessment whether the patient has got Graves' disease or not. The machine will give the systolic peak velocity. It will be, if it is more than 40 centimeter, in certain journals, this is quite diagnostic of Graves' disease. So there is increase of vascularity. Now, I'll talk a bit on pitfall when thyroid gland is being assessed. One is make sure when we do scan of any organ, the whole organ is being scanned. So we must look at, for the ends of the organ. So in thyroid gland, so you go up to the top, the superior, go up to the bottom, the inferior, and you see that the structures is a bit triangular. So you know that you have reached the upper limit, and also you have reached the normal, the inferior, the lower limit of thyroid gland. But sometimes, in thyroid enlargement, they can have retrosternal extension, which is further deep into the thoracic inlet. And we, using ultrasound is difficult to assess, but we know then in our comment that, this thyroid enlargement is just not within the neck, but it has gone into the mediastinum and extend retrosternally. The other thing is that, we need to be careful. Sometimes we see a thyroid septum. It's still a thyroid gland, but when we scan further, then you can appreciate the thyroid gland is actually extend further. This particular sort of band, echogenic band, is not the capsule of thyroid gland, but actually the septum, called the posterior thyroid septum. So we don't want to say this is an extra thyroid tissue, but it is still the thyroid tissue produced by the thyroid septum. As I mentioned to you, we need to look at the vascular structure as well, because sometimes when we see, we start asking ourselves, oh, is this a lesion? Is this a nodule? So you have Doppler, and on the Doppler, and you can see vessels that actually mimic it to be a lesion. The other pitfall is that, especially in a thin patient, where the transverse process can mimic it as a calcified lymph node. Okay, and this is a diagram that shows to us where that pitfall can happen. So you need to appreciate and scan the thyroid gland, and actually the thyroid gland has already extended to its limit. You see the vessels, and if you go further laterally, it's not the calcified lymph node, but actually it's a transverse process of the cervical spine. I think with experience, you tend to appreciate with that.